Hello everyone, this is Steffi. A couple of you approached me and asked me about how I approach a soap note. So I'm going to make a video about how I approach a soap note when I see it. So I'm going to use the example of the individual soap note from last week's exam. So when I first get the soap note, I look through it from top to bottom. So I first recognize that, okay, this is from today. So first step is to know what kind of document I'm looking at, because sometimes it's a hospital notes and sometimes is clinic setting. So then first I have to figure out where am I and then where is my patient coming from. So and then I looked at the chief complaint, and then that is normally the priority. So I normally would just copy and paste this and then put it in the healthcare problem box. And then I read through the history in this paragraph here, and as I look through it and I see relevant information like age and race, why is the patient here, and then I would copy and paste it into the care plan. And then I see that they were recently hospitalized for stroke. So this is related to the chief complaint of stroke prevention. And then next I see that they are here for an IBS symptoms getting worse. So then now I know this is a separate health problem. So then I would copy this and then add another health problem and then put in the second box and then label it IBS. And then I keep on reading and then I see that they also have an OA pain. So then I would then come up with a different box and then put it here. So that's, now I have a preliminary setup for my disease state, and then as so the order is very important. So the first problem is almost always the chief complaint, and then stroke secondary prevention is a big deal. So that's problem number 1. And then between IBS and OA, that I'm not sure which one's worse yet. So I just preliminary put it here, and then as I read through the case, and then I will determine which one is worse. But most likely IBS at this point because the symptom is getting worse, and then their OA pain is 4 out of 10. So it's moderate, but then it wasn't like 9 out of 10, which is very severe. And then I see the patient's vital, and that temperature normal, heart rate's a little low, BP is elevated. So then the vital is the next thing that I would put in for stroke prevention. And then pain scale here will go into the OA box. And then patient's BMI, I normally wouldn't calculate it right away. And then so I would just leave myself a note and write BMI here, BMI, and then maybe creatinine clearance. And then so coming down, I see that patient has 2 allergies, aspirin and sulfa. Okay, now this is very important. I will write here allergy, and then just leave them here for now. And then keep on coming down with the past medical history, so we know the patient has stroke. And then so what's relevant with stroke? Diabetes, hypertension, hyperlipidemia. So then we know that all these disease states are risk factors for a stroke. So then I'm going to put them in the stroke box. And then OA, we know patient has heart failure. And this sits in when we see heart failure, we can think about various different treatment, beta blockers first line, and then spironolactone if their ejection fraction is less than 40. So that's something that I would think about here. And then family history, mother had a stroke, so that's a positive family history. So I would write family history significant for mother with stroke. Okay, and then social history, I see that they are a social drinker and then they also smoke. So then that would also go in this paragraph here, social history, significant for smoking and alcohol. I would list how much they drink and how much they smoke in here, but I'm going to skip it for the sake of time. And they also drink like 5 cups of coffee, which is a lot, so I'm going to take notes of that. And then skimming through their diet, it looks relatively healthy, nothing too oily, kale chips, watermelon, lots of fruit. So then I would write like healthy diet. And things you want to note here is like anything too oily or too spicy, salty, and or specific diet. And some minor exercise, okay. So then when I get to the home medication, I look at every one of their medication and I would separate them out by disease state. So I know aspirin and clopidogrel are antiplatelet medication. It's probably related to a stroke. Also, amiodarone here is for rate control for AFib, so that's very important. And then I know lisinopril is blood pressure, and that's secondary prevention. Simvastatin for cholesterol, secondary prevention. And then also their diabetes need to be controlled, so they have 2 diabetes meds here. I'll highlight them in blue. And then more hypertension medication here in red. So then these are their medications that are relevant to stroke secondary prevention. So then I will list these medications into my assessment, and then I will look at it and determine if these needed to stay on board or not. So earlier we saw that patient was allergic to aspirin here. So then my approach here was that I understand this as a true allergy, so patient had hives when they take aspirin, so then they definitely shouldn't be on aspirin. And then also I see that it was recently started, so it's probably started at the hospital while they were hospitalized for stroke, and then since now they are discharged, and then they stayed on the aspirin. And I see that clopidogrel was started 5 years ago, and then this is most likely due to their valve replacement surgery that I know people keep antiplatelet on for post-valve replacement for lifetime. So then that clopidogrel is also first alternative for aspirin for antiplatelet purposes. So I would probably discontinue this due to allergy. And then again, I will put this in assessment plan. So then these are like the rough, now I have a rough idea of what I want to do with their home medication, and I will go through them one by one later. But by this point, I would put all of these in the assessment box. And I'm not going to do that here for the sake of time. And then coming down to medication adherence, this is very important. I almost missed this line during the exam. So it is very important to know that they strictly follow their medication, because if they don't, then that could be a different story. Because amiodarone is a rate control medication, and then that you want to make sure they follow it, because if they don't, then that could be a big risk factor for having another stroke. And also coming up here, noting that their heart rate is 75, so then the goal is between 80 to 90. So then their heart rate is at goal, so then that's very good that we know that amiodarone is able to control their heart rate. And coming down here for physical assessment, and we see that everything is normal with a normal limit here. Then it's very important to note that patients, the cardiovascular, since they have AFib, so then their rhythm is right. And then the PMI has shifted, and then it's something that I would write in my assessment, but it's not anything that we can really do about it. And then also they are ANO times 4, which is good. And then note that they have trace edema. I didn't really address that here, and then I think it's not a major concern at this point. And then also coming down to lab, and then I normally only write down significant lab values, so then I would just go through and see which ones are abnormal or borderline abnormal, and then you can see that sertraline, it's a little elevated here, and then glucose is okay. Calcium, magnesium, phosphate, albumin's also good. Liver enzyme normal. WBC normal. Here, platelet normal. Then their LDL slightly elevated, so then we saw they were on simvastatin earlier, so something that we could take care of in a bit. So I would list these 2 labs and then write everything else within normal limits. Okay, and then that's it for secondary stroke. And then now I have all the information from the case, and then now we'll go back and then look at their medication and see what I need to address. So then I said I would keep clopidogrel, DC aspirin, and then since their heart rate is controlled with amio, I would keep. So I would keep because heart rate in control, and then there is no concern at this point. And then for their metformin, so their diabetes, their A1C goal is 7. So we have A1C is 7.1 here. And given patient's age and patient's glucose of 97 here, I would say their A1C is at goal, their treatment is appropriate. And however, I did notice that they have a 50 units of insulin here. That's quite big. So then I said that I would evaluate the glucose log to make sure they don't have hypoglycemia. So right, look at log and make sure no hypoglycemia. So I would write all this in assessment, and I just am writing here for the sake of time right now. And then so the next thing is blood pressure, and then I see that their blood pressure here is 140/89, and then which again it's over 130/80 the goal. So then that I would increase, I would make 2 changes. So I need 2 changes, but then I see that lisinopril 40 and amlodipine 10 here, both at max dose. So I won't be able to change the dose of either one of these drugs. So then the next thing I can do is to add another medication. So the next treatment in line is diuretics. So because of their heart failure, I went with spironolactone. So I did spironolactone 25 milligram once a day, and that was my initial management for this patient's blood pressure. And I also, it's very important, actually let's do it over here. So assessment, so post-stroke, need to calculate the CHAS-VAS score, which is very important. And then I calculate this patient's score at 6, so which means they need an anticoagulant. So my anticoagulant of choice for this patient is warfarin. So I need to be initiated. So I will initiate warfarin over here. So initiate warfarin 5 milligram daily. And then so with all my changes I talked about here, that would also go in. So the changes I made here under home medication would also go into the plan as well. So follow up, so the things I want to monitor, well, first of all, I initiated warfarin, so INR, and then I want to monitor signs and symptoms of unexplained bleeding and bruising. And I also want to monitor signs and symptoms of like melena or like bright red blood per BPR, yeah. Okay, so I wanted to make sure if they're bleeding anywhere from GI, and then that's like coffee ground stools, things like that. And then the next thing I want to continue to monitor is heart rate, and because they're on amio, and then their goal is 80 to 90, and then so blood pressure, it's very important to monitor 130/80, and then I want to monitor their LDL, and then Chem 7 because they're lisinopril, and so I want to keep track of their potassium level, and then plus I just initiated spironolactone, so it's very important to keep track of that. And then metformin, we want to keep A1C and glucose, keep monitoring that as well. And then we want to monitor their cholesterol and their LFT. And then patient is smoker, so we want to monitor smoke cessation, and then like trigger log and things like that. So then because we initiated warfarin, we're going to follow up in 1 week. 1 week with initiation of warfarin. Besides warfarin, if you initiated or changes of insulin, then you also want to bring them back 1 week. And generally, if they are being discharged out of the hospital, you want to bring them back in 1 week to make sure that there's no acute changes to their disease state. And then you can see them once every month after INR is stabilized. So that's how I would approach this case, and of course there's a lot more details in here, and I don't want to make this video too long, so feel free to reach out to me and then ask me any questions. I can try to help as much as I can. Alright, well, have a good day.